Hello everyone and welcome to our 83rd AeHIN hour webinar. If you need assistance, please feel free to send us a message through the chat window. And if you're having difficulties in configuring your connection, please log out from the session and rejoin again. You may also use your smartphones or tablets to join by using the webinar ID 632499395. Before we start our webinar, here are a few reminders. For attendees, your microphones are muted throughout the meeting. Add your thoughts to us through the chat tab, and for questions, please type them in the questions window. Tonight's speaker is Ms. Yael Misrahi, who leads the business development efforts of Mobile OTT with a specific focus on developing partnerships with international nonprofits and global health organizations. Ms. Yael's background is in international development and human rights, and she most recently worked with international nonprofits, including Innovation Africa, the American Jewish World Service, the Israeli Fund for UNICEF. Ms. Yael specializes in the social impact of introducing new technologies to rural communities and low-resource settings and has worked in India, Nicaragua, and 3 East African countries. Ms. Yael also holds a bachelor's degree from Wellesley College in International Relations and a master's degree cum laude from the Interdisciplinary Center in Herzliya in Government and Diplomacy. We will now call on our speaker, Ms. Yael.
Thank you for that introduction, Shah. It's really a pleasure to be with you today. So I'm going to share my screen with you right now. Excellent. And are you able to see my screen in the presentation?
Yes, it's loading now. Thank you.
Terrific. Thank you. So thank you everyone for joining us. My name is Yael, and I'll be telling you a little bit about our company, Mobile ODT, and our technology. We are a medical device company that leverages mobile phones and mobile technologies to really expand access to services and to enable cervical cancer screening at the point of care, but in a much smarter way than the traditional way that you're used to. So I'll give you a little bit of background about us as a company. We're a Tel Aviv-based company with offices in Nairobi and San Francisco and soon London. And our real vision was to have universal access to quality examinations. And the first spaces that we are doing this in right now are in cervical cancer screening with the colposcope, the mobile colposcope that we developed, and in forensic examinations, which also uses the mobile colposcope and uses it both for body cavities inspection and also for cervical cancer, for cervix screenings. So let's just take a minute to think about why we started in cervical cancer. Many of you probably know already that cervical cancer is the leading cause of death amongst women in mostly low-resource settings. It's the 4th most common cancer in the world and the 1st or 2nd in most low-resource settings. And the most tragic thing about this is that cervical cancer is really a cancer that we're able to catch early and treat if it's caught early. Despite that, in Asia, we're seeing that screening coverage is as low as 3%. So as a company, we've really been thinking a lot about what is the challenge here. A lot of it has to do with access to tools and with access to specialized care. So if we think about what the current methods are for cervical cancer screening, we're looking at visual inspection with acetic acid. VIA has a lot of challenges with it in that it's subjective, it depends on the naked eye, you don't have a lot of quality assurance with it, and it really is, it's the minimum bar that someone can do for cervical cancer screening. Then you have Pap smears. Pap smears are expensive. They still don't have very high sensitivity or specificity. And of course, they require all the infrastructure of a lab. Then you have HPV DNA tests, which are becoming more and more common. And you still have many challenges with that in terms of procuring HPV tests, the cost of them. And then on top of all this, you have colposcopy, and the challenges with colposcopy, of course, are you need the expertise, and colposcopes are extremely expensive. So when we think about these challenges, we really are facing a challenge of price, shortage of expertise, and then, above all of that, is lack of data for decision makers. So we oftentimes don't have the information and the statistics to know just how many pap smears are available, how many women need to be screened, how many women need to be treated in which regions. And this lack of data and information makes it very difficult to form policy decision making in terms of what a hospital should be doing. So what our company's developed is called the Enhanced Visual Assessment System, or the EVA system for short. And it really aims to be an end-to-end solution that integrates seamlessly into the clinical workflow that we're already familiar with. So I think integrating a lot of new technologies can often be very challenging if you're changing the clinical workflow. And what we've done is instead taken a new technology that integrates naturally into the clinical workflow that nurses, doctors, midwives are already familiar with. You use the standard patient information, you intake patient information on the mobile phone, you visualize the patient, then you use the technology to get support or a second opinion, refer that patient, store those patients, and have all of that data inside of a warehouse. Now, generally, this is a workflow that requires lots of different technologies with many different people involved in several different steps. With our EVA system, you're able to conduct all of this with one tool. And I'll show you how that works. We've done that by combining a hardware and software solution to facilitate this holistic care. If you look on your left, you'll see a screenshot of what our app looks like. This is the app that lives on the mobile phone that comes inside of the colposcope, the second image on your left. The app is used for patient intake information, and then you're able to use the colposcope. Right here, it's a small handheld device that you can either use with a stand, mounts onto any universal tripod, or handheld, so you can use it for screenings and outreach locations or in smaller clinics. You use the app to then visualize the cervix with the magnification. You have a green filter, you have video capabilities, you have the ability to annotate those images, and then everything that's captured inside of the mobile app is then uploaded to a cloud portal. And we can use that cloud portal to be able to print patient records for them, to request consultations, to have conversations with other providers to ask for a second opinion. And then all of this automatically also generates statistics, so that if a hospital has 20 different locations and they want to see how the strength of their cervical cancer screening program, they are able to see what each one of those locations, how many screenings they're conducting, in how many women are being screened, how many women are being treated, and they have a sense of what's happening in real time. So a few more details about the hardware. The hardware, as you can see here, uses a mobile phone, but it integrates very nicely into the design so that for the patient has a lot of confidence. They can know that they're in the hands of a healthcare provider using a very professional colposcope. The image quality is equivalent to a Welsh Allen. So if you're familiar with that, you'll know that it has a very strong magnification. We're looking at 16 times magnification. It's battery powered, so you don't have to worry about any power shortages or about traveling from one clinic to the other. It's 10 hours of rechargeable battery, which you can charge the same way that you charge your mobile phone. And then, of course, we have a lot of questions about connectivity. What if there's no internet? Well, because you're using a mobile phone, you can also insert a SIM card and upload images automatically using that SIM connectivity. Now, between the optics and the light source, you also have a cross polarizer for glare reduction, so that even after applying the acetic acid, you're still able to really visualize a very well illuminated, magnified cervix without the glare. Here's an image of what the app looks like. You'll notice at the top, on the right-hand side, you have details, images, and decision. This is what your patient case looks like, and that's why I said it integrates naturally into the workflow for clinicians. You have the patient intake where it says details, then you go into images and you see a screen like this. You have the green filter that you can turn on by pressing that little green button on the bottom left. You can turn on a video, or you can capture images. And then you're able to enter the decision. Here you have a couple of screenshots. The patient intake information is has various different fields and can be customized and also can be integrated into various electronic health records. So I know many of your hospitals probably have EMRs. There's a very easy way to capture everything that's captured on this phone and upload it into your EMRs. And then when you're entering a decision, we're really facilitating a flow that helps clinicians enter the decision. You can choose whether it's normal, abnormal, or if the exam was incomplete, or if they need a consultation. If they select normal, they then have the ability to request that that patient come back for a referral. Here you have a couple of images that you can see of what it looks like after you capture an image of the cervix with the regular filter, with the green filter, and then what it looks like when you're able to annotate. Now there's a real value here, especially for training courses. We were talking about the challenge of expertise and lack of expertise. So even though you're able to now equip more people with an affordable, portable colposcope that's able to enter smaller clinics, it doesn't necessarily mean that you have the specialization. And we don't always have the ability to do remote consultation in real time. So what you have here is the ability to also use annotations in order to indicate where each location, every suspicious lesion might be, so that you can then share this case and use it as part of a grand rounds later on to continue capacity building throughout time and really improving the expertise of your workforce. So we can train nurses on doing this and then improve their expertise over time and have annotations on all the images that they've been capturing. If you do have the capability to do consultation, many large hospitals have this. We're often seeing large hospital networks that have one expert who's sitting in a central location, and then all the other smaller clinics referring to that to that one center. And that center is often overburdened with a high number of referrals that in some cases may be unnecessary. And it's really a shame to use the resources and the time of that expert for that. What you're able to do through this app is actually send remote consultations, so that rather than having to send a patient over to that referral hospital, we're able to send a remote image along with those annotations and request a consultation remotely, all online, saving us a lot of time. The other nice thing that we've seen is that patients often don't know a lot about their cervix. They haven't seen it, they don't know what cervical cancer is, and they may not be motivated to go out for treatment. What you're able to do with the EVA system is show the patient her cervix, communicate it to her, print the patient record, she can take it home, and really encourage her to take part in the decision making about what kind of screening she wants to do, what kind of treatment to pursue. And we've often seen that this is actually generating much more interest for more women to come in for screening. Finally, I'm going to share with you actually a live walkthrough of what it looks like after you've conducted the examination at the point of care. We were talking about using the EVA system at the point of care to take in patient information, capture images of the cervix, and capture that decision. But then where does all this information go? You can have a look here. Chuck, will you just confirm that you're able to see my screen?
Yes, I can see your screen. Thank you.
Terrific. Thank you. So here you'll see I've logged in. It's a very secure cloud portal, all HIPAA compliant, meaning US standards for patient confidentiality. And when you log in with your username and password, which I've just done, you're able to see your cases, your statistics, conversations, and QA here stands for quality assurance. Let's begin with the cases. So you've logged in, and the first thing I can see is all the different cases that have been captured within my hospital system. I'm also able to sort them by different providers. So if I have 30 different hospitals and I want to see what's happening in each one, I can go through and sort them based on that. Once you enter the record, you can download it into a PDF if you'd like. You can export the case, you can export the images only. You can see here those annotations I was talking about. You're able to click on them and see which healthcare provider entered that annotation and what they wrote. In this case, we have some aceto whitening change. These are all plastic cervixes, in case anyone is wondering. You can see the patient information that was captured, the provider decision that was captured, and then if there was a review by an external provider, maybe a supervisor or an expert, you would be able to see that in this section here. Next, if you specifically have questions, if you have a larger program, or even if you have a small program with multiple providers, you may want to have ongoing conversations about specific cases. If you want to do that, you can use our feature for secure collaboration, which you're able to access either directly from the cases or here on this tab called Conversations. We'll go into an example right here. That will open up a specific case that we've been talking about. You can see that there's been a conversation here between Ariel Beery and Jennifer Mickelson. And you can have a back and forth conversation. And every time we enter a message, it sends an email notification to anybody involved in this conversation. And you can add an unlimited number of collaborators to that conversation as well, just by entering their email address here. They will receive an email notification letting them know that there is a case that they're asked to review, and they'll be able to enter the portal through their username and password and log in to participate in this conversation in a very secure manner. This has really helped a lot with being able to provide the absolute expert care that we're trying to bring to even the most rural areas. So you can have a more rural clinic where a nurse is conducting the examination, for example, or a new trainee doctor, and if they have any questions, they're able to use this feature to be able to securely collaborate with an expert in a central hospital. In addition to that, one big challenge that many programs have been seeing has to do with maintaining quality. This is a critical issue for many hospitals. You want to make sure that there's a certain level of quality for all different aspects of care that we're providing. And in this case for cervical cancer, especially with an examination that does require a visual inspection, it can be very subjective. And what we've developed here in order to address those issues of quality assurance is our QA tool, which you can see over here enables healthcare providers at the expert level. So Jennifer is our expert today. She's now, you can see at the top here, has 12 cases to review. They come from various different clinics and various different providers. And she can go through and see the different images that were captured in particular cases. She can see the annotations that were captured, the information about the patient. We know that this patient is 40, she's HIV negative, and yet it was diagnosed abnormal. And it looks, and she was assigned cryotherapy as treatment. And when we're looking at the images, Jennifer may disagree with this. So she can then, using the QA tool, click on disagree. Looks normal. This is just blood. And she can move on to the next case. And she can continue doing this, looking at the various different cases and deciding whether there's agreement or disagreement with the healthcare provider. And after conducting as many cases as she has the time to do, she can generate a report. And these types of reports are really critical for hospitals that are trying to also demonstrate that they're maintaining the quality care that they want to maintain. You're able to see that here she reviewed 2 cases. All of them were sufficient for assessment. None of the patients were underdiagnosed, which is excellent news. It was all from the same healthcare provider. However, we have only a 50% agreement rate. So what does that mean? We're able to see now the breakdown in the agreement rate. We're saying the patient was actually not underdiagnosed, but rather she was overdiagnosed. And this gives us a sense that perhaps we then wasted our resources on cryotherapying a patient that actually had a normal cervix, which is also very informative in terms of what we want to do for our program, how we want to better train our staff so that these mistakes don't happen again. That's the tool for quality assurance to really ensure the quality of a cervical cancer screening program. And finally, for the administrators, what's been really very exciting for administrators, for hospital presidents, for ministers of health, we're able to look at the statistics that are really generated as different images or as different cases are being captured. You can sort it by a certain time period, by certain clinicians or clinics. In this case, we can see that in all of our history of this demo account, we've seen 29 patients. All of them have been in Tel Aviv Yafo. But you can see you have a world map here. So if we're in Manila, for example, we'd be able to see how many were captured in Manila, how many were captured in Buenos Aires, how many were captured in Delhi, and you'd get a sense of exactly what your program's looking at. And then the breakdown of the statistics, the diagnosis, how many were normal, how many were abnormal. And from there, of those abnormalities, how many were pre-cancer and how many suspected cancer. Now, these statistics are really very important in helping us to better understand what kind of treatments we want to be providing. Perhaps we need to buy a new chemotherapy machine, but we don't necessarily know if it's a worthwhile investment unless we have this kind of data and information to make those informed decisions. Finally, you get the information on how many women have been need to come back for rescreening and a whole image library that can be used by an expert gynecologist to train others. And you can sit down, have a grand rounds, and look at case to case to be able to to improve the training of the program so that we can expand access to other services. Okay, I'm going to just go back here. Excellent. So that's really an overview, a rather brief overview, but I hope it gave you a sense of how our system works from point of care, image capture, patient intake, all the way to entering information and then really, really leveraging the technology, the e-health technology, in order to make informed policy decisions and, of course, provide expert care in any location. Another thing we found very exciting about using e-health and using a portable mobile device is that it's really scalable. One of the big challenges we've seen with cervical cancer screening programs and colposcopy in general is that a traditional colposcope is large, it's bulky, expensive, it's cumbersome, and it relies on one individual to really conduct that colposcopy. When you're looking at the EVA system, you're looking at something that is smaller, more affordable, handheld, can be used in any location, and enables constant conversations between a healthcare provider that's still learning how to conduct colposcopy to have a conversation with an expert healthcare provider. So it really does enable that scalability of programs to expand access to care. And of course, for the hospitals to then generate income, because you're now able to conduct an expert examination in more locations and more often. It decreases that loss to follow-up, and also, as we've seen with the statistics, we're able to make more informed decisions about where we want to invest when it comes to our oncology care. As far as where we've been working, we're a young company. We were established in 2012, and since then we've expanded to over 25 countries around the world. We can also add India to this map. It's not highlighted, but it is a new project that we started in February. And we're really very, very honored to be working with some of the world leaders, including MD Anderson Cancer Care, Montefiore Hospital, Apollo Hospitals, Partners in Health, and several others. So thank you very much for your time, and I really hope that we have an opportunity to expand into further locations where you are working and to work with you. I'd love to take any questions if anyone has any.
Yes, thank you for that lecture. We are now opening the floor for questions. If you have questions, please type your questions in the questions tab. We'll be waiting for your questions. I would like to ask if this is only for the diagnosis, or do you also let doctors um like uh, give advices on treatment?
Thank you for asking that. And you're asking specifically about, are doctors able to provide consultation on diagnosis?
Ah, yes. Thank you.
Yes, absolutely. There are two ways to do that. There's the ability to do that in real time through the app and the remote consultation. The way I showed, actually, I'll bring it back to that slide. It would look something like this. So if a provider in a more rural location that is not as trained has a question in real time about a diagnosis, that provider is able to press the consult button rather than entering a diagnosis, to press that consult, and that will send a notification to an expert provider in their network that can then send back a consultation recommendation. That's one way of doing it. The other way of doing it is through that secure collaboration in the portal that I showed you. In many instances, you're not necessarily able to get real-time consultation either because of connectivity or because of the availability of a healthcare provider. And so what the system enables someone to do is to have that long-term, maybe at the end of the day, maybe at the end of 2 days, to provide a consultation. And oftentimes you might find that a woman, rather than traveling a couple hours to a referral center, would rather go back to the healthcare center that's closest to her to receive that second opinion.
Yes, thank you, Miss Yale. We have another question. This one reads, how many doctors are on standby for advice to confirm the cases in real time?
Certainly. So we as a mobile ODT with the EVA system provide the platform. That means that as many experts as you have in your hospital network, we're able to provide them with logins in order to be able to conduct those consultations. So we don't provide those consultations. Those consultations are provided from within your network. But if your network has 2 expert gynecologists, so you'll have 2 people providing that. If they happen to have 30, then you'll have 30 people, each one with their own login and the ability to provide that consultation.
Okay, thank you, Miss Yale. Our next question is, how can you use the scope in several patients? Do you have a disposable plastic sleeve to avoid cross-infection?
Thank you. So the scope never comes into contact with the patient. It's, let me, the scope doesn't come into contact with the patient. You're able to hold it 43 centimeters away from the cervix, which is a good 15 centimeters away from the end of the speculum. So in the way that it works is that it integrates into the clinical workflow of conducting colposcopy or VIA or PAP or HPV that's being done already, and it enhances that using the colposcopy with the EVA system. That means when a healthcare provider begins using it, they'll still put on their gloves, insert a speculum into the patient, and then begin using the EVA system. It does so, since it doesn't come into contact with the patient, there's no need for disposables other than, of course, the regular speculum and the gloves. However, you are able to disinfect it. Should it touch the patient, you can wipe it down with any high-level disinfectant.
Yes, thank you. Here's another question. Would you be able to inspect the vaginal wall with the scope?
Absolutely. Absolutely. You can hold the EVA system, again, about 40 centimeters away from the cervix, which gives you the ability to look at the vaginal wall as well. When it's being used for forensic examinations, we're looking at the vaginal canal, we're looking at the entire pelvic region. You're also able to remove the lens if you want to capture even other images. So in sexual assault documentation with forensic nurses, we're also capturing bruises. You can remove the lens to capture all of that, and it still gets stored on the same online system.
Yes, thank you, Michelle. I have a question. Um, do you Are there cases when, for example, I'm in one clinic, I'm a doctor, and I would like to ask some more information about how I can diagnose this patient? Can I ask for help from another clinic to do that? Is that
You
possible?
absolutely can. Yes. What we found is that generally hospitals want to maintain that information for patient privacy within one network. However, there have been many cases where people have wanted to collaborate with clinicians outside of their network. So I'll take us back to this screen where you can look at the secure case sharing, and this is exactly the scenario that it was developed for. It still enables healthcare providers from different networks to be able to collaborate on specific cases, and they do this by, you can do this by entering into your cloud portal through your username and password, and then inviting anyone using their email, where it says here invite people on the right hand side. You'd enter their email and you'd be able to let them, either they can edit your patient case or view the full patient details. If you only want them to view, you'll click on that and then press share, and they'll receive an email notification prompting them to enter into the portal and be able to view that specific case. So you really can conduct that secure collaboration and that case sharing with anyone, whether they're in your network or outside of your network, but it's still very secure in that you're able to choose which cases to share with them and whether you only want to enable them to view or to also edit and share notes.
Yes, thank you. Another question, Michelle. I might have missed this earlier. uh, how do you store the data from the device? Is it via a cloud?
Yes, the data is automatically, as you enter it on the mobile app, it automatically uploads into our secure cloud portal. And so when you're accessing this information, you saw I just accessed it on my personal laptop right now. I entered the website portal.mobileodt.com and entered my username and password. And because it's stored on this cloud, that means that even if you're traveling, even if your other collaborator, the other clinicians are not by their desks, they can still access the cloud portal in a secure way by entering that website, portal.mobileodt.com, and using their username and password to log in. And they can do that on a laptop, iPad, tablet, even on their phones. It's really made to be very, very easy to use. One of the big challenges we've seen with a lot of EMR systems that are used for this kind of collaboration is that it's their software that are based on one specific desktop. And we know that the future is really about clinicians that are traveling and working in more clinic than one, and you don't want to be stuck only being able to conduct those case sharings or those examinations in one location. So by using the cloud, you're able to access the information anywhere.
All right. So, what if there's no internet, Miss Yael? Do I have everything recorded in the application first, and then when I have access to the internet, it will automatically sync?
That's exactly it. That's exactly it. Yes, and again, because it's a phone, if you don't have access to the internet, to Wi-Fi, you can use a SIM card. Many of the programs, we have programs in India, for example, that are a little bit more rural, and some of them are using SIM cards as a backup for when the internet isn't as strong. So they're able to sync regularly on the internet, and then when they go out for a screening campaign, they sync over a SIM card. Or if there's no SIM card connectivity, they conduct a full day or a full week of screening. It's all stored on the phone, and as soon as they arrive at a location where the SIM card connects or where the Wi-Fi connects, everything is uploaded onto the cloud so that the patient information is never lost. It's always available, and you still don't run out of storage, because as it syncs, you're also able to archive cases so that you're constantly able to add more and more cases to the phone.
Yes, thank you, Miss Yael. Another question. Do you have a register of all the doctors and nurses who have access to this application?
We have, that would be a list of all of our customers so far. So I would be happy to share some of them that are comfortable sharing their information. We have some people from the National Cancer Institute, from MD Anderson Cancer Care, University of Pennsylvania, Apollo Hospitals, and several others. I wouldn't be able to share a list of everyone because that would be quite confidential, but I can certainly share with several partners.
I asked because I was wondering, what if we have this system in our clinic, and then how am I sure that this person is really allowed to access the system?
So everything, when you log in, you'll be able to see all the clinicians within your network. And that's part of the process that we do. We're a bit of an untraditional medical device company because we don't just sell the colposcope and say goodbye. We are partners in many ways. And that's why we have the ability to provide more specific and customized patient intake information based on the hospital network's electronic health records and what information they want to capture. And then also be able to have a conversation as to how many users you want to have on each system. And you as the customer would define how many users, who's allowed, what their level of ability to see cases is. So when you have two possibilities, either a clinician can only see their own cases, or a clinician can see all the cases in their network. And so you would give us a list of all the clinicians that are going to have a user account, and from there we'll indicate which ones only will see their own cases and which ones will see everyone's cases for review. So it's really done collaboratively with us.
Yes, if we have the system, it means we have to relate to you first, who will be accessing everything. So every time we have a doctor or a nurse who should be included in the list, we have to coordinate with you first to give them credentials.
You send us an email and we create it for you. It only takes a few minutes. Yes.
Yes. For example, I am a nurse and I need to access a patient's record, but I lost my password. Does that include, can I reset my password, or it has to come?
You can reset your password on the portal. I'll take us back here. As I log out, you'll see that happens almost all the time, actually. Am I still sharing my screen?
Yes.
Excellent. So still on that same website, portal.mobility, you click on forgot my password. Forgot your password? Yes, it happens all the time. Enter your username, which is your email. Press submit. You have to enter, and you'll receive an email prompting you to create a new password. So you'll never be locked out of your of your cases. Don't worry about that.
Yes, thank you. Any more questions from our audience? We will be waiting for your questions in the questions box. If you cannot locate it, you can also enter your questions in the chat box. Thank you.
So, Cha, I think if there are no more questions, I will just say I'm happy to continue taking questions. You see, you have our information here for our website and for our email address. We're currently selling in 26 countries. We are FDA and CE approved, and we are also have an office again in Nairobi and are opening one in London, and I'm beginning to have a presence in India. We're really hoping to expand our impact throughout Asia. What we're looking for are good partners, good distributors, hospitals that are ready to pilot this. And if you're interested in purchasing an EVA system, please feel free to email us. And if you're interested in learning more, you can also find more on our website or email us with more questions. I'd be more than happy to speak with you.
Yes, thank you, Ms. Yael. For our participants, if you have questions, you can contact them. Or if you would like, you could also chorus your questions through us and we can assist you. Thank you, Ms. Yael and Ms. Kathy. Thank you to all participants as well.
Thank
Have a
you
good
very
night.
much.